How long have you been feeling dizzy for?
I felt this for about 3 days.
Okay.
There are
And
30
then,
million
my
people who are low income in this country for whom the only site of care is a community health center. Community health centers have an extremely difficult time accessing specialty care whenever the needs of the patients become more complex than they can manage.
Hello, good morning. It's nice to meet you.
Typically, since many of our patients are uninsured or underinsured, it's really hard to get them into a specialist, and that patient would have an exorbitant out-of-pocket cost.
If you work at a community health center, if your patient has diabetes and needs some specialty advice from an endocrinologist, and if there are no endocrinologists, how will the patient get care?
El Rio Health, like all the other federally qualified health clinics, specializes in a population that definitely meets the criteria for
I was
underserved.
wondering, were you able to get a hold of that patient, the one who didn't come to her appointment today? Just kind of worried about her.
The value that we're trying to bring as the MAVEN volunteers is giving them access to consultants on a pro bono basis.
Hey, how are you doing today?
I'm doing good, Dr. Wright. Thanks for your time today and letting us
MAVEN
talk
is an
about this case.
infrastructure that allows a system of volunteers to serve a system of clinics at no charge.
So we have our same gentleman who we've talked about before, 65-year-old male, chronic kidney disease, stage 4. So I just wanted to touch base with you because I know this gentleman is not insured and can't see a nephrologist like we've talked about until he
Our
gets to
volunteers are
dialysis
all
this
best-in-class
year. So we just wanted to
physicians,
touch base with
many
you
of whom
to see
have
if our
years of
words were
experience in
last
academic
time
medicine
ago.
and in clinical care.
The question has to do with when might he need referral for urgent dialysis. There's no survival benefit to starting early. In fact, you could argue the clock starts running once the dialysis machine starts running.
Being able to check in with a nephrologist has been invaluable. By using the MAVEN Project, we're able to strengthen and maximize the patient's health care, even in the absence of him having insurance.
The trick here is to hang on to your clinical intuition who says, this guy is doing better.
The MAVEN Project is using the Justworks Spring Forward grant to further develop our provider portal. For providers in the field, time is everything. Now they can access education, mentoring, and consultations all in one place.
How's your short staff situation working?
It's eased somewhat from the height of the Omicron surge.
This pandemic has created significant burnout as well as shortages, and our physicians, many of whom have educated generations of medical students, really provide mentorship and support to improve the quality of practice life.
It's not only physician well-being, it's personal well-being.
Any family history of any?
The MAVEN Project's goal is to meet the needs of providers in the field,
Have you been using the bracelet?
so they in turn can meet the needs of their patients in places like El Rio.
All right, it was great to meet you again. And I'll go ahead and put in that referral if you want to get that done.